Join HealthClick on an evidence-based educational journey into stroke. Establish a greater understanding of stroke etiology to achieve evidence-based pathways for positive functional outcomes. Why is the average length of stay in a hospital setting a critical number to know? What is the main factor that affects every patient diagnosed with a stroke? What will become of this person after being discharged? Will they function independently? Will they need assistance in the home? Can they go back to work or play? Will they be sent to an assisted living facility? Stroke is the third leading cause of death in the United States, and it is one of the primary reasons for disability. We are in a new era of strokes, where a large percentage of stroke patients are under 55. Develop an understanding of the implications of a stroke diagnosis in this younger population. There are new challenges with this younger population, and in many cases, they need to get back to work, play, and maybe care for children. Develop a real understanding of the mechanisms of injury and residual effects of a stroke in order to help develop individualized patient goals for the best possible functional outcomes for patients in all age groups. Learn the foundational information needed to maximize functional mobility with patients that have suffered a stroke. Patient testimonials provided by 3 actual stroke survivors will shape treatment plans as the face of stroke in this new medical paradigm is revealed. Explore a systematic approach to functional anatomy in order to develop individualized treatment programs.
We know that there's a difference between cerebral spasticity, when we feel that, versus when we put on someone who has spinal spasticity. We know that those two types of spasticity feel different. And there's a reason for that. When we talk about cerebral spasticity, we are talking about enhanced excitability of monosynaptic pathways due to lack of inhibition. There's a very rapid buildup of reflex activity, and there is a huge bias, as we know, toward overactivity in the anti-gravity muscles. So it makes sense. It's exactly what you see in your patient who has had a stroke. Overactivity in their plantar flexors, their knee extensors, hip extensors, and adductors.
Gain insights into the multidisciplinary approach to stroke rehab and clinical perspectives from a neurosurgeon, physical medicine physician, and a physical and occupational therapist. Explore case studies that focus on specific deficits and rehab measures that isolate function, improve mobility, independence, and tone management in order to promote functional movement. Learn common gait deviations and rehab solutions that address the management of the hemiplegic shoulder and the secondary issues that arise from that immobility in order to achieve a functional shoulder girdle. This course will provide evidence-based options to assist with making the complex decisions that impact the progression of goals in the hospital, outpatient, SNF, or home settings.